Antipsychotic-induced Parkinsonism is a real problem, and it is something that you need to be prepared to treat. However, what I see all the time clinically is the use of anticholinergic medications before somebody even develops this Parkinsonism from the medication, right? So we give this anticholinergic and we think to ourselves, well, it doesn't really matter. It's probably not going to cause much of a problem. But I want you to be cautious, in particular with elderly patients, right? Because they are more susceptible to antipsychotic-induced Parkinsonism, and they are also susceptible to the systemic effects of anticholinergic medications, such as urinary retention, constipation, confusion, etc., right? We also got to be careful for people who are having medical conditions that can be worsened by the anticholinergic medication. So that would be things like glaucoma, enlarged prostates, tachycardia, and severe constipation. Now, what can you do to avoid this situation? Well, one thing you can do is just avoid the medications that are most likely to cause antipsychotic-induced Parkinsonism. And the two biggest culprits are going to be the medication Risperidone and the medication paliperidone, which is a derivative of risperidone. So you can see those two medications are going to be ones you might want to avoid if somebody has had antipsychotic-induced Parkinsonism, or you're worried they might be at risk for it. Other second-generation medications to be aware of that have a high risk for antipsychotic-induced Parkinsonism: Lurasidone or Latuda, and olanzapine Zyprexa.